to bring it to a vote, which would require only a simple majority in this case. The Senate only has until September 30th at the very latest to approve it because of some of the arcane Senate rules. Senator Lindsey Graham of South Carolina says the bill would reallocate money from the Affordable Care Act and give it to the states.
There's a mandate in this bill that goes with the block grant that every state in the nation must cover people with pre-existing conditions. So not one person's going to be denied coverage in any of the 50 states because they have a pre-existing condition.
We're joined by conservative syndicated radio host Kevin McCullough. Also joining us, former President Clinton advisor Doug Schoen. He was an advisor for Michael Bloomberg as well and is a Fox News contributor. Kevin, to you first. A lot of conservatives don't think that this proposal is conservative enough. How do you see it?
I don't know that a lot of conservatives don't. I think Rand Paul has said he has trouble with it, but I think that when you understand that of all of the Senate candidates that may likely run for president for the Democrats, were standing behind Bernie Sanders last week saying single payer is the way we're going to take our party. I think a lot of people are looking at this saying, we better get this done. The message here to the GOP is time is short, and you're being outflanked by a left proposal that's going to flank you to the left. You better get this done.
But whatever they pass has to also pass the House, and this is radically different from what the House already passed.
Yeah, I think the House would pass this if it passed, but we're not there yet, John. There are at least 3 senators who are up for grabs. Lisa Murkowski, probably the swing vote ultimately, and we're talking about hundreds of billions of dollars potentially being cut from health care, millions of people losing coverage. Frankly, I disagree with my good friend Kevin. I think this bill is much too conservative and much too onerous. I think, frankly, I'd rather leave Obamacare, flawed as it is, in place than replace it with block grants and leave it to the states.
But when he says, I'll ask you, Kevin, when he says millions of people would lose their health care, aren't those people who are opting out of the individual mandate?
In large measure they are, and the opportunity to affect that may be another piece of legislation that they can address more succinctly later. The advantage of the block grants is because you move money from the federal pockets to the states, and the states will spend it more wisely. If you have a lot of obese people in Mississippi that deal with diabetes, and you've got opioids and tobacco issues in West Virginia, why can't those governors independently decide which ones they want to allocate funding for most appropriately for their region?
I think I hear Doug agreeing with you on that. I don't know.
No, I don't think so. I get the logic. The problem is I don't want to leave people's health care up to the whims and vagaries of state politics. I think we need national standards and a national system. That being said, premiums are too high, coverage uneven, insurance companies pulling out now. We need change, but the American people, John, want to fix Obamacare, not replace it with a radically new system.
Let's take a look at one nationally run healthcare system.
Sure.
The VA.
Yep.
It's been a mess.
Sure.
And it's run by the federal government, and everybody loves our veterans. So isn't that kind of symptomatic of what kind of health care you get when the federal government's in charge?
The VA offers care directly itself. It's not an insurance scheme like Obamacare, in fact, is. They're really different programs, different circumstances. And frankly, I just reiterate, I don't want to go to the vagaries of states and state legislators and governors being responsible for our wellness as a country.
All right, so what's your answer to that?
The bottom line is Democrat and Republican governors are going to like the block grant measure because it's going to give them more autonomy and greater ability to meet the needs of their individual citizens in their states. This is always a better thing for governance by government to be controlled closer to the people than further from the people. My good friend Doug Schoen, he wants a national standard. I want the states to be able to effectively meet the need. And when you have doctors opting out of programs, when you have some states where you've only got one provider now, you do not have adequate coverage.
But what about Rand Paul's argument that this is trillions of dollars of federal tax money or federal borrowing that's essentially then given back to the states?
He's not incorrect, but it is a step in the right direction.
And I think it is a step in the wrong direction.